Welcome to those of you who are just joining us. Just hang tight for a few minutes while we let people log in. For those of you who are just joining us, just hang tight for a couple of minutes while we give other people a chance to log in, and then we'll get started. All righty, I think I'll go ahead and get us started. Welcome, everybody. As a reminder, for those of you who haven't joined us before, hi, I'm Hilary Godwin, Dean of the UW School of Public Health. And while anyone is welcome to watch this webinar or take part in it, just a reminder that the guidance that I'm providing is for the UW School of Public Health. So for students, faculty, and staff who have their primary appointments here, or this is their primary school. So if you're from another school or even a different organization and you want to know whether or not the things that I've talked about apply to you, the best person to ask would be your boss or your dean at whatever your school is. So, okay, that's item number one. Item number two is that we don't in these sessions use the chat box other than if there's something that you want people to be able to see for the entire time. Like sometimes people have shared resources. That's a great thing to put in the chat box. But if you want to ask a question, please use the Q&A box instead of the chat box. Oh yeah, and a reminder, we don't use the hand raising function just because I'm not that technically proficient yet. So, so if you have a question, put it in the Q&A box and we'll get to you. So today we're going to talk about student stuff. I'm super excited. We have two special guests who are students in the UW School of Public Health, Amanda Shee and Shanise Owens. We're going to share some of their experiences and concerns about online learning so far and just world life in the time of COVID. And then I also have as panelists today, Stephanie Farquhar, who's our Acting Associate Dean for Education and also Clinical Professor in Health Sciences and DEOHS. Lisa Manhart, who is our Associate Dean for Research and a Professor of Epidemiology. Victoria Gardner, who's our Assistant Dean for Equity, Diversity, and Inclusion. And Juanita Ricks, who's our Director for Student and Academic Services. And the way that we're going to do this is I'm going to give some general announcement kind of stuff, both sort of bringing people up to date on what's been happening this week, both in the bigger world in terms of COVID and also what's going on here in the School of Public Health. And then we're going to head over to our conversation with our students. And if you have additional questions about other stuff, feel free to post them in the Q&A. We'll come to general question and answers at the end. So if you post a Q&A, be sure to indicate, is it for one of the students? Is it for one of us? Is it a general question? But we'll eventually try and get to all your questions. Okay, so general update. Worldwide, as of today, there have been more than 3.7 million total confirmed cases of COVID-19. with global deaths reaching more than 260,000. Nationally, there have been more than 1.2 million cases reported, with more than 71,000 deaths. And our hearts go out to all of those who have lost loved ones or who are struggling with COVID-19. For those of you who've been following the modeling world, IHE folks just released a new updated model that combines two different modeling approaches. So as a result, their estimates for projected deaths in the United States is now significantly more than it was. So if people ask you about that, it's because the model changed, and as models do. And also they're incorporating new information. But in general, they're trying to incorporate into that model, factoring in easing of restrictions and social distancing in many states, and greater movement of people that we expect over the coming months. At the start of this week, 27 states had lifted restrictions in some way or another, but only 20 of those states had met the White House criteria for easing stay-at-home policies, which was to have 14 consecutive days of a downward trajectory of new infections or positive tests. So we're expecting to see we are seeing already a patchwork response, and now a patchwork removal of restraints. And so we're going to see all sorts of different outcomes across the United States, and keeping our eyes on that and figuring out what that means from a public health perspective is going to be interesting. Washington State, as of yesterday morning, had 15,000 and almost 15,600 confirmed cases, 862 total deaths, and had conducted over 219,000 tests with an overall positivity rate of 7.1%. An important thing to keep in mind with that 7.1% positive rate is that the majority of people who have been tested to date are people who are symptomatic. So the actual prevalence in the population here in Washington is expected to be significantly lower than that. And as we start to see some surveillance studies launched that have broad testing of individuals regardless of whether they're symptomatic or not, we are hoping to get some more insights into what the true prevalence is. Big news for us was that on Friday, Governor Inslee extended his stay home, stay healthy order through the end of this month, through May 31st, but lifted restrictions in some sectors of the economy, including opening up the parks. Woohoo! So that's good news. He also outlined a 4-phased approach to gradual reopening. As I said, as part of that first phase, state parks opened yesterday, and fishing and golfing are now allowed with some restrictions. So golfing, it's parties of 2, unless everyone's from the same household, then you can have 4. And we expect to see more restrictions being lifted in the days and weeks to come. Another really big important change was lifting restrictions on residential construction, some of those restrictions. That's really important for our economy. We expect to see some changes in terms of landscaping firms and auto dealerships coming back into opening up in the coming days. So gradually starting to see that dial sort of shift towards fewer restrictions. On June 1st, which could be probably the earliest that we'd expect to see shifting into the second phase. So Governor Inslee said minimum of 3 weeks at each phase, unless you're one of these 10 special counties that had really low numbers of cases and very low density populations. And so they're allowed to petition to skip the second phase first. But for us, it'd probably be June 1st. We could expect to see barbershops, hair salons, and perhaps some retail stores reopen. And return of other businesses, including allowing restaurants to open up and have customers inside at half capacity. The third phase which the earliest it would be 3 weeks later, but it's dependent upon us reaching some critical milestones. We could expect to see gatherings of 50 people or fewer, lifting restrictions on non-essential travel, and perhaps even some indoor sports. In the fourth phase that he outlined, we would expect to see pretty much normal public interactions, but with social distancing measures still in place. Again, the earliest that could be implemented was after 3 weeks of phase 3. So there we're looking at the middle of July at the earliest. But again, we'd have to hit some critical metrics in terms of making progress in order to be able to move there. So, of course, we're all monitoring these pretty closely, but having these phases mapped out is going to be really helpful for us as we start to plan for what's likely to be the case in the late summer for summer session B and then for the fall. So that's really helpful for us in terms of planning. Updates from the University of Washington at the town hall that our president and provost hosted last Friday. The provost mentioned that the University of Washington is seeing a decrease in revenue. A lot of that comes from decreased use of housing for students and food services and athletics, and will have a profound impact on our budget. President Kelsey announced, and I'm excited to hear this, that the UW is planning to hold in-person classes next fall, with the caveat that COVID-19 gets to decide for us whether or not that's actually possible. So that's our aspirational goal, is that we're trying to get things lined up so that we can have in-person classes next fall, but it's not going to be business as usual. So some things to expect. For large classes, we may still logistically need to do those using online lectures, but we're hoping that we're going to be able to have in-person sessions for our smaller classes or for discussion sessions. And we would, of course, need to provide some online access for members of our community who, for some reason, can't get to campus, whether it's a visa issue or it's a personal, maybe they're sick and they're staying home to protect the public health. So more information about how all those things are going to be dealt with will be rolled out in the coming months, and we'll be working with our faculty to make sure that they're prepared, because not everyone who's teaching in the fall taught this spring, and so we have a new group of faculty to help sort of bring up to speed in terms of some of these online modalities. So we're starting to see in King County something that most of us expected to see but are unhappy to see nonetheless, which are some racial disparities related to COVID-19. Hispanic, Black, Native Hawaiian, and Pacific Islander groups have been infected and hospitalized at significantly higher rates than whites in our county. Hispanics were hospitalized so far have been hospitalized at 4 times the rate of whites and have experienced a death rate of 2.5 times that of whites, according to Public Health Seattle and King County. And I encourage you all to go and take a look at their website. They now have 2, maybe this is DOH actually, but 2 different dashboards, one that's general statistics and one that's looking at health equity issues. You know, I think we're going to hear a lot about this as public health people going forward. It's important to continue to message to people that those disparities are reflections of existing inequities in our society, that we're seeing COVID-19 reinforcing disparities that already existed in terms of access to health care, and that those are some of the dominant reasons why we're seeing these effects. And it's incumbent upon us as public health professionals to address those upstream determinants of health that create those inequities now more than ever. Amazon announced that some of its workers would continue to work remotely until October 2nd. I think you're going to see similar things here at the University of Washington, maybe not for that long, but continuing to provide people with options to work remotely when they're able to, particularly as we're transitioning through these phases, being respectful of people who have vulnerabilities because of prior medical conditions or because they're taking care of someone who is vulnerable. So if you're concerned about those things, I encourage you to talk to your supervisor. We're encouraging supervisors to talk to employees about how they can be flexible and accommodating to make sure that when people return to work that they are not only safe, but that they are comfortable with the environment that they're working in. We also have a return to work group on campus that's looking at issues like how do we make sure we have enough social distancing? How are we checking to make sure we have regular cleaning schedules? How are we messaging to people? New guidance came out this week about systems for attesting that people need to attest in Workday that they are not experiencing any symptoms before they show up for work. So all of those are designed to try and, as we transition back into on-campus activities, that we do so in a way that's safe. Other interesting news, the FDA issued an emergency use authorization for the antiviral drug remdesivir after trials showed that it was effective in reducing hospital stays among severely affected patients in the United States. Interestingly, a similar trial in China didn't show those same results, but it had to be cut short because they saw the pandemic waning, which is great. So good news, but not a, the like silver bullet that any of us were hoping for, but another tool in our arsenal. The latest modeling from the Institute for Disease Modeling in Bellevue suggests probably about 46,000 people have already been infected with the coronavirus in King County, as opposed to our 6,600 confirmed cases. Still a really small percentage of our total population here in King County. It's helpful to know what the actual rates are, but important to remember that we still have the large percentage of our population who are immunologically naive with respect to COVID-19. And so as we start to phase out of these restrictions, that we're going to have to be careful to make sure that we don't do so too quickly, and that we're monitoring to make sure that we don't get any quick big resurgences, and perhaps may have to dial back some of those restrictions and reincorporate them if it looks like cases are coming up too quickly. Other data showing up saying that the virus appears to have been around in Europe far earlier than we thought. A study this week showed that French doctors discovered that a patient who was treated with pneumonia in late December actually had coronavirus. That's more than a month earlier than the previously reported first case in France. So lots of stuff going on. I think probably for us here, the excitement of moving forward, but also the reality of it's still going to be a long haul. And so this is a good time for us to sort of take a step back and say, given that it's going to be a long haul and we're sort of halfway through the quarter, how's it going? What's the experience been like for our students? We'll hear from some of our faculty as well, because we used to have some faculty as panelists. But we really wanted this opportunity to hear from students and sort of hear what you're experiencing. We have our two panelists here who are going to talk a little bit, and we're going to ask them some questions. But I want those of you who are in the audience who are students, please feel free to put stuff up on the Q&A. It doesn't have to be a question. It could be just this is how I'm feeling, or this is what I'm experiencing. We're trying to use this as an opportunity to get information out to you guys in a new medium, because I know probably you, like the rest of us, are tired of getting emails with all sorts of details about stuff. So this is a chance, and maybe a little bit more friendly format to hear about some resources that are available and to get some of your questions answered. So with that, let me go back to introducing our panelists. Shanise Owens is a first-year PhD student in the Department of Health Services. She has a master's degree in global mental health from London. And importantly for me, she actually lives near me, so I sometimes see her out on walks around the neighborhood. But we're social distancing, wearing a mask. Amanda, she is graduating this spring with a dual degree in a public health global health undergraduate major and political economy with a minor in dance. She's currently working on a capstone project at King County Vulnerable, oh, this is a mouthful, King County Vulnerable Population Strategic Initiative, and is interning at Global Watch, which is the Global Center for the Integrated Health of Women, Adolescents, and Children in Global Health. So I have a note here that Shanise is going to have to leave right at 3:30 in order to attend class. But with that, I'll sort of kick it off. Do you guys want to say a little something, or should we just start with questions?
I'm fine with questions, if that's most helpful.
Okay. Stephanie, you wanna kick off the questions? Are you there?
I am here. Here I am.
Okay.
I'd love
Stephanie,
to.
For the students, introduce yourself in terms of like what you do in terms of teaching, and because that's probably more interesting to them than most of the stuff we usually talk about.
Yeah, sure. Yes, I teach, as Amanda knows. I teach the School of Public Health 481. It's the undergraduate fourth required core course for our undergraduate public health global health students, and it's ethics, social justice, and policy and public health. So not only in this position as acting associate dean for education do I get to talk to instructors and students about what it's like moving from in-person to online, but I actually get to live it with quite a large class of almost 100 students. So that is my role in terms of instructing. I also will teach a large master's level class come winter term, and I'm so appreciative to Victoria Gardner and Juanita Ricks who suggested that we have this conversation today. And looking at our numbers for spring term, the spring term enrollment, we have 210 classes that we were able to move online. In fact, I think we're able to offer all of our classes. Maybe there are one or two that we were unable to offer, but so almost all of our classes moved online. We have almost 1,800 degree enrolled students right now taking courses, 831 undergraduates, 931 graduate students, and then we have 730 students graduating this term. So this is really important to us to hear from graduate and undergraduate students, their perspectives and their experiences last quarter. So the 4 questions that we posed to Shanise and Amanda, I think I'll just start with the first question and we'll open it up to each of you to answer. And then we really encourage others to drop into the Q&A any questions that you might have for Shanise and Amanda, or any similar or different experiences that you've had as instructor or as student. So the first question for Shanise and Amanda is generally, how are students feeling or doing right now midway through spring quarter, week 6?
Amanda, I'll go first and then you can jump in if that helps. I know Amanda and I probably will have different perspectives since I'm in a PhD program and she's an undergraduate student, but I think the feelings are kind of mixed. I know at the start of the quarter, there's a lot of confusion and kind of unknowns, which I think raises anxiety, and a lot of people just trying to figure out how they do class online and particularly at home, which may not be an environment that's really conducive to doing work. And so I think, you know, this has become a little bit of a new normal, and I myself have figured out how to work at home effectively and to be most efficient, but it did take some time. And I think I still go back and forth between thinking this is great. I, you know, roll out of bed and I'm ready for class, but then other days it's just like, oh my gosh, I just need to be outside and get fresh air. So, you know, that can be very challenging. And for myself, I'm away from family. I don't really have any family in Seattle, so concerns about them can be very difficult, but I think students are, at least that I know, are trying to balance just the stress of school, the normal everyday stress of school, and then also the stress of living in the unknown and maybe being worried about family and friends.
I think I can kind of reiterate the same gist where it's in between, where I don't have to walk all the way to health sciences, but also on the same other hand, as a graduating senior, and I live with 10 other girls, and I think a lot of future plans are in the air where this is like our senior spring quarter where we're like traditionally would be getting ready for like taking our graduation pictures, having our families come to town and graduation ceremonies. So I think it was working through a bit of disappointment there, but also it's the adjustment curve. While it's been difficult, we're still happy to have an online ceremony or the opportunity to come back. But the other thing is the potential financial issues for some of my friends who have been paying for school or other bills or supporting their family in some way. I know that's been difficult. And also graduating into a high unemployment rate and an uncertain job market has been something that's been on our minds, I think.
Thank you to each of you. I appreciate you sharing your personal perspectives. So can you tell us what's working about online teaching? And then maybe along with that, what do students need more of right now to successfully complete this term?
I can go first on this one. So I think what I've kind of reached out to my friends, and everyone really enjoys that the online lectures are recorded, and also the availability and accommodation of staff for office hours. And another really great portion, I know in Stephanie's class as well as Capstone, we have like these participation surveys that at the end there's always some type of question about what's working, what's not working. And I think that feedback cycle is really, really important. And also we enjoy that the adjusted curriculums, like in Capstone, we're working on COVID response, and a lot of our different classes, we're actually looking directly at the effect of COVID on public health. And I think that being in this major and being in this school, that's really, really important.
I will also say I agree with everything Amanda is saying. Just the recordings are really helpful to go back, particularly if you have a roommate and all of a sudden there's a bunch of noise in the house, you may miss some points. It's really nice to be able to go back and get that information. And then also I will have to commend, and hopefully my professors don't mind me naming them, but my biostats professor, Suzanne May, has been fantastic with allowing for questions and balancing that need for students to get responses right during the class with their questions and understanding things, but then also moving the class along in an efficient manner. And I've really enjoyed her class. And then also in the health services department, I'm taking social determinants of health with Barbara Baquero, and she's been very flexible because it's a very long class. I believe it's around 3 hours on very, very difficult topics around disparities and discrimination. And it can be really heavy to do, particularly during this time, for 3 hours and having those conversations. So she's been really flexible with making alternative schedules for our class. So us meeting in person for an hour, hour and a half, but then other ways for us to continue the conversation, whether it's through workout groups or discussion sessions on Canvas. Those have been really nice alternatives than staying on Zoom for 3 hours straight talking about very difficult topics. So that's been really great, and I think it really helps for students who have decided to go home and maybe spread out across the country, so they're in different time zones. So a class that may be at 3, it's really at 6 dinner time for them, and so that flexibility I think has been very helpful for myself and my peers. And then in terms of what we can see more of, I do think one thing that's missing, and it's just the nature of being at home, is that natural communication flow you have with students and professors when you see them in the hall and you want to ask questions, and the social support that you may get being in person that you're not getting online. My PhD director, her name's Emily Williams, she has started a and also, I can't forget Jessie, the assistant director, they started a PhD happy hour, which has been really nice. So when you can call in, you can have this great social support with using happy hour. And we have a Slack channel that I honestly don't use, but at least it's there in case you need. And so that's been really great to encourage students to find a way to support one another and check in. And I think those check-ins are really important because mental health can be really hard during this time.
So I have a question. So if you were to say, like, this thing was so good that we should always do this from here on out, regardless of what happens with COVID, were there any things that were like that where you're like, you know, I love that thing? Is there anything like that, or not really?
Well, we bring our pets to class, but I don't know if we can continue to do that. But actually what I really, really like is the focus. I know we focus a lot on mental and emotional health, like Shanise is saying, but I think that continued acknowledgement of that in the beginning of a lot of our classes, like if you need to deal with something, because everyone's processing different things in your life, and that's only compounded right now, but I think a reiteration to focus on that and the focus on creating meaningful bonds with your cohort. I know that as a senior, I've made friends within the major, but that could be so much more difficult if you're a younger student. Just those two reiterations pretty much. And the dogs.
And I also think what I find to be different is I think there's this thing when you're not in person, it's easier to ask a question that you may have versus if you're in person in a lecture hall of 100 people. I think people are less likely to ask questions. And I'm not sure how we transfer that into in-person classes, but I do think people who normally wouldn't speak up for various reasons, whether they're shy or they just don't want to talk in front of a huge classroom full of peers, I think the channels that Zoom provides gives alternatives for you to speak up and voice your opinion or ask a question that you may really have, but you don't want to do in front of people. And so I think that's really nice, particularly since I'm going to say I feel like women sometimes don't ask as many questions in large groups. And so I think that's a really nice aspect of the Zoom kind of classroom.
Do you think that people are using office hours more or not necessarily? So I was sort of wondering, like, maybe it's less intimidating to go to office hours because it's like a video chat. I don't know.
I'm finding office hours to be harder via Zoom. I prefer
Really? Okay. Okay.
But that's because biostatistics can be very challenging, and I like it in person better. But
yeah, that's interesting.
Yeah. It's interesting.
We were actually really worried. Not just me, but like more the biostats faculty were actually really struggling with. They're like, it's going to be really hard to teach biostats remotely. And so I'm interested to hear, Shanise, that you've been actually having a good experience with it. Is there any like technical things that Suzanne is using in terms of like, I don't know, tablets or something like that? Or how does she do like, I don't know what biostats class does, but like problem solving in class, or how does it work?
She uses, and I'm going to get the name wrong, I think it's the stylus that's provided to her. So that's really nice. So we can see her writing live. And so that's really great to organize things. And then she also does these great polls, which are a great way, another way to give feedback without having to do it in person and no one knows that, you're choosing the wrong answer. And I think that's a really great way for her to take the temperature of who really understood a concept and who didn't. So those are some of the things she does in class.
Yeah, that's really helpful. It's interesting because when we first realized that in the winter we were going to have to very quickly move to online, and then of course now in the spring, and I mentioned this on a call that I was on just a half an hour ago, we thought deeply about and surveyed students and faculty about their IT needs and hardware, software needs, and will you have the bandwidth to log on and do a video Zoom, for example. And then we were realizing that the needs ran much deeper than that, which we probably could have anticipated, but because we were so focused on just the pragmatic of making sure that everybody could get online, then we realized, there are a lot of other things that are happening just in terms of speaking to the mental health and social connectedness challenges of having everything online and not being able to meet in person. And I know some of the ways that we've tried to connect is through office hours, though I would agree those are less successful now than when we're meeting in person. But the breakout rooms, the worksheets, poll questions, chat boxes, it does seem like there are more voices and more different voices being heard and being included in class. So I appreciate hearing that from your perspective as well. So if we were to move, if this continued to be a reality into, say, autumn term or into next year, are there a few key, what would you suggest either we continue doing as faculty and instructors, and what would you suggest we sort of drop or modify or change? And this can be your own personal perspective, or it can be what you're hearing from other students.
Okay, well, specifically in your class, Stephanie, and in Capstone, I really like, I really like the breakout rooms and the use of them. Like you said, I think it gets in those smaller settings, people are more comfortable sharing, like in 4-5-person groups maybe. And we have a policy review group in your class, and that's really, really helpful because I feel like I've already bonded more with those girls because that's a continued group of 3 meeting over and over again, and we talk about, oh, how was your week, but also we can talk about work, and I think that kind of check-in is really important. The one thing that I don't really know how we'd work on this, but engaging with different types of learning styles. I'm a visual learner, so I'm like just seeing the slides, having those beforehand has been really helpful for me, but I know others could be kinesthetic learners, and how to engage their learning style to best help them adapt to a different format. I'm not quite sure how that would look, but I think adjustments could be made to maybe accommodate different learning styles.
Yeah, that's helpful. Shanise, do you have similar experience or thoughts?
I would say if this kind of format in terms of engagement in the academic world continues, I would really strengthen the professional development and kind of the career staff, because there are a lot of things, particularly, if you're well, any student, but particularly if you're a PhD or master's student, going to conferences and presenting things are really crucial to building your CV. And so missing out on those opportunities, how do you replace them with things that help bolster your CV? And Amanda mentioned, going into the job market with a lot of unknowns. I think, this has been a short period where a lot of people have been worried and concerned, but if this extends, I think this really brings about a lot of, I don't want to say fear, but for lack of better words, I'll say fear for young people who are trying to figure out what they want to do in the world, and with opportunities being reduced tremendously. And also, even if you have an opportunity, being concerned about your health and well-being, or your family's health and well-being. So, should you take on a position that could put you at risk? Just more guidance for students who are kind of feeling anxious about the unknowns. I think that would be really, really helpful, particularly through the summer, where I think schools probably kind of drop off in the minds of students, or vice versa. Schools may not think as much as about students during the summer, but really keeping that connection with students so they can have resources to help them, guide them through concerns. Students have bills and concerns about finances too, and and also the professional career, and it really can weigh heavily on us if our schools are not helping us through that.
So Shanise, that provides a beautiful transition into, we're seeing some comments from some of the other attendees, and I've heard this as well, of just huge amounts of angst that students have. You mentioned them not being able to go to conferences, but even on a sort of more immediate sense of students who have practicum requirements, particularly the global health lens. We have global travel restrictions right now that they're feeling pretty anxious about how are they, how are they meeting the formal degree requirements, but also how are they making sure that they're getting the preparation that they need for the careers that they want, given all the constraints that we're facing. I don't know, Stephanie, do you want to talk a little bit about, I know it's not just we're easing up on the requirements, there's this whole other part of the, you actually need the professional experience. But do you want to talk a little bit about sort of what's been going on nationally with SEAF and us within the school in terms of flexibility around internships and practicum requirements?
Sure, and then I see Juanita would like to jump in, so I want to turn it over to you as well, Juanita. Yes, absolutely. So the accrediting body, the group that accredits schools of public health, has recognized very early on, and this is not the same for all health sciences schools, dentistry and pharmacy and medical and nursing school had different experiences and social work, but very early on, our accrediting body for public health recognized the challenges of being able to do in-person capstones and practicums, for example, and are granting credits and sort of waivers for doing an experience that might look different and might not be on site. For example, if a community-based organization is looking for a literature review or development of a survey or something that would help them, that would also allow the student to achieve the competencies for that practical and applied experience, then that still, counts as an applied or practiced experience as far as SEAF is concerned. And then in terms of University of Washington and our loosening of restrictions on what we allow for grading options, I saw in the chat box from Global Health student representative that in fact the option for SNS, which is satisfactory, non-satisfactory, has been implemented. So students are allowed to request or utilize the SNS for any class, regardless of whether it's a core required or elective class, which has been a barrier to using that as an option if that gets in the way of graduation or course requirements. So that that will be voted on in Faculty Senate next week, which will make it official, but it looks like the momentum is moving towards allowing SNS options for students, which relieves some of the pressure for a numerical grade, for example. So people are recognizing that this is a very different situation and that we work within the constraints to make sure that students who are aiming to graduate this term or soon aren't harmed or slowed down by restrictions. Juanita?
That's correct. Yeah, and we definitely want to see students kind of work in tandem both with their faculty and with their advisors on making sort of informed decisions about what the implications of those things are. Typically, obviously, graded coursework may be required for certain type of applications, and there'll be annotations on the transcript that explain kind of the circumstance. I think that there'll be very few people who'll miss this as a period of great difference in the academic setting, and we'll probably see that universally. But we have also heard the feedback that because of so much that's been disrupted and changed both within class and other ways that students are preparing for kind of whatever comes next, be that next term or next degree or employment, that it would be helpful to sort of think about how to frame this experience professionally and for progression. And so we've been doing some crowdsourcing of kind of responses to that, both across the school as well as across schools of public health, noting, of course, that again, this is a universal experience right now. We're also working with our partners in Career and Internship Center on that. And then I would add that, as all schools are experiencing this in the same way, we've actually had really good responses and relationships with other schools of public health that are looking at ways to do things jointly that will support students. So for instance, hosting career fairs online through our association that'll really sort of allow all students to kind of, in this context, meet with employers and start to talk through current opportunities as well as sort of what's being forecasted.
Yeah,
So Juanita, just to be a little bit more specific, so when you were talking about the sort of crowdsourcing things, are you referring to, like, during DACs we had a question about, like, how might I indicate on my resume or CV that, you know, this was, I was supposed to, actually got, you know, a travel award to go to this conference, but the conference was canceled and so I wasn't able to present, like things like that?
Exactly, things of that nature. And even, you know, locally, our students who participated in MPH Zoomposium and undergraduate Zoomposium, and speaking to the kind of changed nature and yet still the relevance and the competence and the experiences that were developed and what sat underneath it that was relevant for kind of that next opportunity.
I see a question in here that I'd really like us to move to, and I think that Juanita or Victoria, you might be best positioned to answer this, but the comment is, I appreciate the desire to keep this conversation lighthearted, but many students are upset, frustrated, worried about their academic future, and struggling with physical and mental health. This conversation feels tone deaf to that reality. So I'm wondering, Juanita or Victoria, if you can speak to some of the supports that you have recommended and worked with.
Thanks. Yeah, I'll start because I'm unmuted first. So first of all, I completely appreciate that comment, and I want to use this opportunity first and foremost to say that there isn't a person that I've worked with here at the University of Washington in this School of Public Health who doesn't want to hear about student struggles and doesn't want to partner with students to address and alleviate those. This is an unusual time. This is incredibly stressful, and we hear it and we know it. And we know that folks are experiencing it differently, and we want to sort of, rather than applying universal solutions when they're not merited, work with individuals who are experiencing things in more negative light. That said, there are a number of resources available for all of the ways that folks are addressing the stress, the anxiety, and the isolation, depression that those things may cause through the university that we're promoting. We've actually put together some wellness resources specifically on our student resource page. They're linked to in our SPH Canvas shell that we'd like to kind of call attention to for students. We have tried to kind of, and have heard from our advisor colleagues across the school that they are ready to be of assistance, and they're ready to call in the dean's office as need be. And we're here to be partners. We're here to be the first partner or the last partner, or whatever door you go through. We want to make it one that's supportive and open to being of assistance. We are, you know, keeping track of resources on campus, such as the Technology Loan Fund, the UW Emergency Fund, the CARES Relief, things that are kind of available to us to turn students to. And when those aren't options, looking at what is possible within the School of Public Health as well. But we're all open and, you know, willing, able. We're here for your support. That's the point of working in a university. So don't feel like you're sitting with these things alone.
Right. And I think, you know, the more you can share with trusted folks how you're feeling and how you're doing, you know, the less isolating the experience can feel. Because, you know, we are all isolated right now. And so I think that we just need to also think about reaching out to other folks and taking care of our own selves, using the things that have made us stronger, connecting and reconnecting with our traditional foods and practices that we've always had that we may have forgotten. What are those things that, you know, we can use to help keep us well and safe and healthy? I am available online. We can do Zoom appointments if you're interested in setting for students and faculty and staff to set an appointment with me. But I'm also getting lots of, you know, emails from students about different concerns that they're having. And I want you to know that we're here with you. You know, you're not alone in what you're experiencing. I've had my own family members diagnosed positive with this disease. It's impacted my family. 4 of my family members have had COVID. And they're all here in Seattle, and we're all okay now. But so you're not alone. We are all functioning through this crisis, and we're just trying to all make it. And so I appreciate all of you for all the work that you're doing, students, faculty, staff, and students, for all the hard work. It's not easy, and it is a different world. I want to acknowledge that, you know, the careers are different, but remember why you came into public health. This is why we're here. This is why we wanted to do this in the first place, is to help end the inequities that persist and amplify when these things happen, and to keep us all healthy. So remember why you're here and your goal and your vision for doing this work, and, you know, and you stick close to the vision and stay connected to that vision so we don't waver from that path. And we're all in this together, for real.
Yeah, just to amplify that, I know my department chairs often tell me that I'm irrepressibly positive, and that's not always a good thing. But to echo what Juanita and Victoria are saying, this has been, you know, it hits different people in different ways at different times. Behind what looks like an irrepressibly positive exterior, you know, I literally have been on the phone multiple times with family members, walking them through is it time to go to the ER? It's scary. And I honestly can't even imagine what it would be like to be someone who's just about to, you know, it's always stressful and scary to be at that transition between college and whatever your next step is, or between graduate school and the next step. Those are really hard life transitions at any point in time. But to be having to make those life transitions when the whole world is in upheaval, you guys are going through a lot. That was the reason that we wanted to have this conversation, was that we wanted to make sure that we, not to sort of go like, hey, everything's great, but to say we know, and your faculty, you know, if they seem distracted and like they're not sympathetic, my guess is it's probably because they're teaching from home and they have 2 kids screaming in the background. I know, like, people always say to me, they're like, how come you're wearing headphones? It's like, because there are people screaming in the background unexpectedly, and otherwise you'd all hear them. So behind Mount Rainier there, you know, it's not so pretty. So, and we are struggling too. I mean, we don't know in terms of what the job market's going to bring for you guys who are graduating right now, because nobody knows. We can be pretty confident in saying that public health is a good degree to be getting right now, in terms of immediate job security and probably long-term job security. That being said, it's a really weird time to be trying to interview for jobs. And so we do want to hear from you guys if you're struggling with that. If you have suggestions of things that we can be doing, I love the idea of working with the other schools of public health to do a virtual career fair, trying to think of other resources as well. So I also have been pretty routinely getting notifications one from the CDC, local health departments about job opportunities, particularly right now because everyone's trying to ramp up their contact tracing workforce. So that I make sure you do actually check that. What's the name, Juanita, of the thing that Renee does every week for students? Because she posts them on there.
Thank you. It's the SPH Insider, and it comes out on Monday mornings to your email inbox.
Okay. Yeah, so we will keep posting stuff there. Keep checking. But please do, it's not that we're trying to put the responsibility on you. Again, I understand that sometimes when you're in having the most difficulty, it's when you have the least capacity to self-advocate or ask for help, but we really do want to communicate. We are here for you. And if you need extra beyond the sort of baseline support that's being provided, reach out to us because we can help and we will help.
Yeah, and I would also add that, I mean, now as you're thinking about jobs, next steps, graduate school, whatever it may be, I mean, one thing that many students do quite well is network and connect, and you can still do that. You can still ask faculty for time to talk about what their suggestions might be if they know somebody at the health department or Department of Corrections or whatever it is, you know, wherever your interests lie in terms of next steps. So you can still do that even if it's not in person, even if we're not, you know, sitting in offices, and I know that that would be welcomed. And I know Shanise has to go to class, so I'm wondering if Shanise and Amanda have any parting words for us and those on the phone.
Yeah, I think just in terms of for faculty and instructors, you know, thank you for your time and energy with being accommodating and reworking things so they fit this format. I think I'm always, pre-COVID, when I go to the grocery stores, I always like to look at Us Weekly, and the stars are just like us. And I think as students, we forget the faculty and instructors are just like us, and they have children and partners and families and pets that they're worried about and concerned with. And so I do believe this time brings out that humanity and that kindness between the teacher and student relationship, and us remembering that, you know, they're doing the best that they can. I know I TA'd for the capstone class last quarter, and this quarter that team worked so hard to reformat it for the students who are not able to do practicum, and that takes time and energy. And so a lot of people are working really hard to make the best of the situation. And I think students should not wait till a survey comes out to acknowledge that, to acknowledge their professors and their instructors currently, and let them know what's going great so they can keep doing that and what's not working in real time. And thank you to also the leadership for keeping this connection and communication open.
Well, thank you, Shanise. We'll let you go, but thank you for serving on DAX and serving as a connection to the other students.
Yes.
Amanda, do you want to say anything?
Yeah, I would just definitely reiterate the same thing. And for individuals who might be going through whatever, I think that going to your faculty, going to your professors, they're really available. Like, I had a family member get a bypass surgery, and it was like a very frightening time, but your faculty will be there for you to work with you. And it's kind of daunting, and you don't, like, normally, like, you don't even want to share that, but especially in this time, like, everyone was really, really open and supportive, and that was really reassuring. And so for anyone who's going through the loss or any kind of COVID or not related, it's the faculty are here, and I'm very thankful for that.
Thank you. Stephanie, did we get through all of our questions? We still have Amanda captive, so we could do maybe a couple more.
Thank you to Amanda and Shanise for being available to do this. That you are the best, the two of them, that is. And more thanks to the students. A comment about the breakout rooms being a little bit awkward and stressful. I know we get mixed reviews on those. Some people love them. Some people find them really uncomfortable. I think that's about it.
All righty. So in that case, then we will shift to updates from other folks and then go back to answering general questions because we got some more general questions. So first on my list to give general updates is, I'm just thinking, Stephanie, do you have updates that you want to provide before I let you go? Or did you do them?
I'm set, thanks.
You're set. Okay. Lisa, did you want to provide some updates?
Yes, I do have a couple of research updates. Thanks, Hilary. First of all, I really want to thank all of the students who've shared so honestly about how COVID-19 is impacting you. That's a hard thing to do, and I really appreciate hearing your perspectives and your struggles. My job is to support research in the school. That's all research in the school, and that does include student research. So please let me know if you are experiencing struggles in your research related to COVID-19. That's an important part of the training that you receive here at the UW. And to the extent that I can help, I would love to do that. There is actually a lot of COVID-19 research happening in our school right now. Our researchers were very well represented among the Population Health Initiative COVID-19 Rapid Response Grants. The announcement of those awards was actually released almost immediately after our webinar last week. 6 of the 21 awards are led by School of Public Health faculty, and another 4 have SPH faculty members as part of the team. There's lots of exciting projects, both those that are led by our faculty and those that are led by people across the university. The projects are listed on the PHI website, so take a look at some of the exciting work that's being done, and I'll provide a link to that site in the summary. For our grant writers, just today, the National Institute of Allergy and Infectious Diseases at NIH released 2 emergency funding announcements. These are for new R01 and new R21 awards titled Rapid Investigation of SARS-CoV-2 and COVID-19. This is exciting for a couple of reasons. One is that they're for new projects, and this really represents a change in the NIH funding strategy for COVID-19 related research. Prior to this, all funding was in the form of supplements or competitive revisions to existing grants. So this opens up many more opportunities for many more researchers to do some really important work. The other reason this is exciting is that these calls for proposals are allowing rolling submission, which means you can submit an application as soon as it's ready, and NIAID will review it as soon as they can, and they want to get the money out the door and get these projects going. So really good news on the COVID-19 related research front. The UW Office of Research today just released guidance about how in-person research will be treated under the governor's phase 1 plan for reopening the state. So this is a phased approach, and in this first phase, there are a few more types of research that have been classified as critical research and will be allowed. Most of this at this point is still laboratory research. Each group will need to develop what they're calling a return to in-person research plan and get this approved by your home department before restarting activities. These plans will lay out how to maintain physical distance in the research space, how to disinfect high-touch surfaces, that daily attestation that Hilary mentioned, that each person coming in each day doesn't have symptoms, and a variety of other procedures to keep people safe, because that really still is the primary Masks will be provided to all persons conducting on-campus research activities, and there will be 1 mask per person per day. So you won't have to supply those on your own for those of you who will be returning to research on campus. For those of you who do work in these areas, your PI will be in touch with more information about timing. They'll need a little bit of time to develop these in-depth return to in-person research plans. For those of you who are PIs whose research falls into this phase, stay tuned for more guidance on how to develop this plan. There's lots of useful tools coming out of the Office of Research. As a reminder, this doesn't apply to most in-person human subjects research that's been halted. That has not been included in this first phase. And we're working in earnest with the Human Subjects Division to begin thinking about what the phase of relaxing the restrictions on in-person human subjects studies will look like. So stay tuned for that as well. And I think that's it. We continue to update the research page on the SPH COVID-19 website. So visit that or check in with me or check in with your department's research council members if you have questions, comments, or concerns. That's it.
Great, thank you, Lisa. Anyone else who's a panelist? Anyone else have updates before I go on to answering questions in the Q&A? Anybody? No? Okay. Okay, so running through the questions that we received. Okay, so some of these range from very general to very specific. The first one is pretty general. So do most people who test positive get retested to confirm that they are over the virus? If so, does this mean that the number of tests is actually more than the actual number of people tested? So while I have heard examples of people who have gotten retested to confirm that they are over, that they are no longer have high viral loads, I don't think it's the norm. I think that most people just wait for, there's guidance in terms of waiting a certain number of days until after you stop experiencing symptoms. Of course, we're still learning a lot about, there's pretty large variability from person to person in terms of how long they have symptoms, let alone how long they are infectious. And so we're still learning a lot about that. But I do think, yes, you could probably assume that the number of people tested is less than the number of tests, because there are some people who've gotten multiple tests, but probably not the majority of them. Another question was sort of more specific to us, which was, even after we're allowed to return to work, can we choose to continue working remotely if your supervisor agrees, if you're immunocompromised, pregnant, or merely afraid for your health or your family's health? So as of right now, the answer to that is yes. And I think you'll see in the governor's phases, he's pretty clear about providing protections for vulnerable populations, definitely in phase 1, 2, and I believe 3. And I can't remember about phase 4, perhaps not in phase 4. So I would say, my read of that guidance from the governor and the way that I am interpreting that is that we need to be able to be accommodating of people who have vulnerabilities. And that would include, for instance, if you're immunocompromised or you're in a vulnerable category, allowing those people to, for instance, work from home if we're not able to provide a safe work environment. So, so the answer, at least for the short term and for the immediate future, is yes. Again, you need to talk to your supervisor about it, because it's dependent upon, of course, you being able to work from home. And in the long run, I think, we just don't know, that this is part of the sort of, as we get into later phases of the pandemic, what's the world going to look like? We're all pretty sure it's not going to look, our new normal is not going to be exactly like the normal that we had before, and which parts, what things continue to be implemented and which things go back to the way they were before. I don't know, but continue to talk to us if you have concerns. We obviously care deeply about the health and well-being of everyone in our school and want to be respectful of that. Question from Steve Schwartz, as I have to say, the real Steve Schwartz, our Steve Schwartz. He asked whether the pandemic impacted the anticipated completion date for the Rosling Center building. So the answer to that is yes, it has minimally impacted it so far. So what we've seen in the last month and a half is that the contractors that are working on the Rosling Center are working at about 70% capacity. And so that what we're anticipating is that the opening will be delayed by about a month, just due to sort of delays. And they're really in the finishing phases of construction at this point, you know, like doing interior spaces and things like that. So as of right now, whereas we had anticipated moving into the Rosling Center in August, we are now anticipating moving into the Rosling Center in September. A big caveat there is that part of what's supposed to happen the month before we move in is furniture delivery and assembly. And obviously, all industries globally and in the United States have unexpected supply chain issues as a result of COVID-19. So is it possible that I get pushed back further? Absolutely. Is it possible also that, you know, our phasing is going to get delayed in terms of the state phase in response to the COVID-19? That's possible, and that could complicate our move in. But as of right now, the current plan is to move in September. Uli, do you want to offer any updates or corrections to that? We can't hear you. There you go.
Sorry, that's right, Hilary. I don't have any better information than that.
Okay. Great, thank you. Any other questions for any of us, from anybody? Going once, going twice. I see someone saying, oh, Lisa, this is interesting feedback. So an anonymous person says they want to share their experience regarding research as a PhD student. This individual needs to use SAS to do data analysis for their dissertation and can't access it from off campus. So they're waiting for a chance to return to campus and resume their work. That's something we can fix?
I would hope so. If this person doesn't mind contacting me directly, I would love that, and I will work with you to see what we can do about this. There should be a way to get access to SAS so you can keep doing your work.
Okay, excellent, because I was going to say that seems like something we should be able to fix. So thank you for sharing that, and reach out to Lisa. Lisa, you want to, well, I guess people can find your email. I was going to say you can put it in the chat box, maybe. We got a question from someone saying, is it safe to hug someone with no COVID symptoms because they're really missing hugs? Which I can totally relate to because I'm a hugger myself. So sadly, I must inform you that the answer to that is no. What we've seen is that there's a significant percentage of people who have COVID-19 and who appear to be infectious, who are asymptomatic. So just because someone doesn't have symptoms doesn't mean that they aren't infectious. So hugging, not a great idea. So my strategy for that, and my husband will tell you that they're getting very tired of it, is that the people that I co-isolated with, I figured they're fair game because we're with each other all the time. But it helps that they're family members. So I'm getting lots of hugs from them, whether they like it or not. But yeah, totally appreciate that. I with this whole thing, there's so many parts of it that are challenging. But the lack of human connection, I think is really one that is most oppressive. So I feel for you, and I send you a virtual hug. Any other questions while we're closing up? Okay, just want to end by saying thank you so much to Amanda and Shanise for being willing to do this. Oh, Lisa just posted her email for the research student can. Oh, we have a question. Sorry, I missed this one. So what do you plan to do to help build community and SPH during this time? So that's a great question. And for the most part, what we've been seeing is initiatives that are at the department or program level. And that's largely because I think most people are closest with the people that are in their most immediate environment. So some examples, Shanise talked about some in her program. I know some of the programs have been doing sort of digital get-togethers within the dean's office staff. Joshana organizes this really nice thing every couple of weeks where people get together and share their pets and their kids, which is it's really nice and humanizing. And I know, for instance, Biostats and EPI have set up. So EPI has a really nice, what's the name of those sites? You know, I'm going to call it Snap, but that's not what it is. Whatever that site is for communicating with each other that
Slack.
youngsters use. Slack. Thank you. Slack. Thank you. I, for a moment, felt very old. Too old. That thing you young guys use. So yeah, Slack. They set up a Slack channel. It sounds like health services did as well. Just like if people need help with something or they have stuff to share, which I thought was really a sweet idea. So people are doing those things. This particular forum is probably our biggest school-wide mechanism for trying to build community during COVID times. And if you guys have suggestions of ways to make it better or other topics that you'd like or things that you'd like to see change, we are totally open to suggestions. Feel free to email me. I'm hgodwin@uw.edu. But we're very open to other suggestions as well. Okay, I got from Renee saying the city of Los Angeles is one of the first cities to offer COVID testing for its people. Do you foresee Seattle following suit soon? So I'm not super familiar with what the LA plan is. So I can't comment about whether or not Seattle's going to do the same thing. Here's what I have heard. I think one of the big differences between the sort of Seattle-wide approach or Washington state approach is that the elected officials are really talking very closely to public health folks. And for most public health folks, our sense is universal testing is not, doesn't really make sense. It's just a snapshot in time, and it doesn't tell you that someone will get sick tomorrow or the day after. So unless you were able to keep doing testing over and over again, which would be prohibitively expensive and logistically super complicated, it just doesn't make sense. So what most groups that I have heard about have been talking about are looking at how can we design some surveillance systems so that we're doing enough testing of people who are asymptomatic, random testing across the population, and then specifically doing additional testing for vulnerable populations in our area, that we can get a better sense of what the baseline is in terms of both who currently is infected and also, so what the prevalence is, and then also how many people using antibody-based tests, how many people have already been infected in the past. So I would say expect something like that. I'd call it's smarter testing. It's not, but will give us some really useful data. And then I guess I would emphasize, I know people have different experiences, but you still can't, people who are symptomatic can get tested. And the Seattle Times, I believe they still do, they had a really great website that listed all the different locations across the city where you could get testing done. So if you are symptomatic and you need to get tested, that's a great resource. But for people who are asymptomatic, testing the whole population, probably not going to happen, would be my guess. Okay, and Lisa answered the question about staff too. Oh, question from Monet asking, would I be open to sharing my thoughts from today's Senate hearing? So Monet is referring to right before this. I was fortunate enough to be asked by our Senator Cantwell to testify for the Commerce Committee in the U.S. Senate, which is looking at how to safely reopen, well, it's already open, but how, as we start to see people returning to using air travel more frequently, how can we do that in a way that is safe and minimizes the risks associated with air travel. So yeah, it was a really interesting experience, kind of like Shanise. I was smiling when Shanise said it's nice to be on Zoom because it's a little less intimidating for students to ask questions. Same thing goes for your dean testifying before Congress. I thought, wow, I'm super lucky that the first time that I get to do this, that I get to do it remotely, because it was much less intimidating to do it from my office than to have to actually show up in Washington, D.C. and be in front of the senators. And they're, like Shanise said, they're just like us. You know, they were complimenting each other on their beards and their hairdos and stuff, so it was kind of cute. So in terms of implications for the aviation industry, I was very impressed with what I heard from the representatives from the different airline consortiums about the steps that the large airlines are taking voluntarily in terms of implementing cleaning protocols. My two big things that I wanted to accomplish with the testifying were, one, to really hit home how important it is for us that some entity, whether it's the airlines or the federal government or a third party, but that there are flight manifests maintained that contain contact information for all travelers for every flight. That's really important for us in terms of contact tracing. That's not currently happening. Right now, we don't have contact information for everybody who flies. So that's a real problem for us. So that was one. And it seemed like although people had different opinions about how that should be implemented, the airlines would rather the government do it, for instance, that there seemed to be consensus that, yes, we need to move in that direction. And there are a couple of bills in front of the Senate right now looking at different ways to do that. So that's great. And then the other issue that I really wanted to surface was just this, that we need to figure out ways to maintain social distancing, not just throughout airports, but also on planes, or people are just not going to feel comfortable traveling. So it was interesting to hear the different perspectives on that. And I guess we'll see what happens. I think probably my best guess coming out of this is I was really pushing, it would be nice to have some national guidance that applies to all the airlines. From a public health perspective, we'd actually like it for it to be actually required. But I would be satisfied with some guidance. It seems like people were sort of coalescing about the idea of at the minimum, having some guidance that was very clear about safety protocols that are required in terms of infection prevention for all airports and all flights across the United States. So I hope that we get to see that. That would be a great outcome. And it was fun to be part of, you know, the legislative process. So, you know, doing our part in terms of public health, of trying to communicate our knowledge and help legislators make informed decisions. So it was fun. Yeah, anyway, so that was my day. We are out of questions. It's all done. So thanks everybody for joining us. Huge thanks to our two students, Amanda and Shanise, for being vulnerable and opening up to us and representing your fellow students. Thanks to everyone who wrote in. Please continue to reach out to us if we can be of help to you. We're open to both suggestions of big changes that would be for everybody, but we're also very open to suggestions and trying to help you maneuver through situations that may be unique to you if you need additional help. So with that, wash your hands, keep your social distancing, wear a mask when you're out in public to reduce your risk, and stay well, stay healthy. And I'll see you guys next week. Thanks.
Thank you. Thanks, Hilary.
Thanks, and thanks, Victoria and Juanita for joining us today.